Hello friends, most of the students revise the common drugs again and again and skip the newer one. In the INI-CET exam, these newer drugs can be asked and these can be really your potential rank boosters. So let us revise the important one in today's session. Before starting the session, if you are coming to my channel for the first time, then subscribe my channel and also watch the part 1 which is anti-cancer and part 2 which is central nervous system drugs if you have not watched previously, and the link for this part 1 and part 2 is in the description box. So let us start with the today's session. Infectious diseases, antibiotics, gapotidacin. This is a DNA gyrase and topoisomerase 4 inhibitor, and remember this is not fluoroquinolone. It causes single-stranded break in the DNA, unlike the fluoroquinolone which causes double-stranded DNA breakage. And this is used in the uncomplicated UTI. The name of which is gepotidacin. So it starts from the G. So it is a DNA gyrase inhibitor, and in its spelling you can see that it is a port. If you reverse it, then it becomes top. So it is a topoisomerase 4 inhibitor, and that is a D in its spelling. So D and G, that makes DNA gyrase inhibitor. So this is how you can remember this drug easily. Now the other drug is a plazomicin. This is next generation aminoglycoside just like streptomycin, and this is used in the complicated UTI. Now another drug is a delafloxacin. This is fluoroquinolone which is active against MRSA, and delafloxacin delays MRSA infection. So this is how you can remember. This is the mnemonic, and it can also be used in the skin infection. Ceftaroline and ceftibiprole. These are the 5th generation cephalosporin for MRSA infection. Roll drugs. These are for the MRSA infection. This way you can remember this drug. Cefiderocol. Cefiderocol is used for the MDR, gram-negative organism, carbapenem resistant Enterobacteriaceae and Pseudomonas infection. So this is again 5th generation cephalosporin, and cefiderocol is used in the complicated UTI. Now coming to the newer tetracycline drugs, omadocycline. It is having MA. MA stands for mast cells. So this is used for the respiratory infections. Eravacycline. Eravacycline is used for the intra-abdominal infections. Sarecycline, S say skin. So it is used in the treatment of the acne. Lefamulin. Lefamulin inhibits the bacterial protein synthesis by binding to the 50S ribosomal subunit. So F stands for 50. So lefamulin is used in the MRSA and also in the community acquired bacterial pneumonia. Now coming to the drugs for the tuberculosis, and bedaquiline is a newer drug and it is a ATP synthesis inhibitor. So AB, ATP synthesis inhibitor, bedaquiline. That is how you can remember. And the important side effect of bedaquiline is QT interval prolongation. It is having Q in its spelling, so it causes QT prolongation. Now pretomanid and delamanid, these drug inhibits the mycolic acid synthesis by generating free radicals, and these you can remember, it is having manid in its spelling. So these are the mycolic acid synthesis inhibitor. So in this spelling you can see there is a NID, so this stands for nitroimidazole drugs. The drugs for the tuberculosis include B-PAM regimen, and this is for the multi-drug resistant and rifampicin resistant tuberculosis, and the previous regimen included 18 months of extensive treatment. Now that has been replaced only to the 6 months, so this you must remember. So these drugs are used in the B-PAM regimen. B stands for bedaquiline, P stands for pretomanid, L is linezolid, and M is moxifloxacin. Now coming to the antimalarial drugs, artemisinin based combination therapy that include artemether and lumefantrine. This is particularly for the uncomplicated P. falciparum malaria for the first trimester of the pregnancy, and this is the new update by the WHO. So these you have to remember. Another drug is tafenoquine, similar to the primequine. This drug is given single dose radical cure So this drug is active against both the vivax and ovale infection, and it kills hypnozoites. And before starting this drug, you have to do G6PD test, just like in the primaquine you test for the G6PD. Here in the spelling you can see queen. So queen can kill both the vivax and ovale. So this is how you can remember its mechanism of action. Now coming to the antiviral drugs. So these include baloxavir, marboxil. This is an endonuclease inhibitor, and it inhibits the mRNA synthesis, and this is particularly useful for the influenza A and B virus infection. Now another drug is lenacapavir. It starts from the L. It is a long acting, active against the HIV-1 infection, and it is a capsid inhibitor. So you can see here cap in its spelling. So it is a capsid inhibitor and it is active against the HIV-1 virus. Another drug is a cabotegravir. It is an integrase inhibitor for the HIV pre-exposure prophylaxis. So in its spelling you can see tegra stands for integrase inhibitor. So this was about the newer drugs with the very easy tips and tricks. And if you like this video, then subscribe my channel and watch the next part for the new drug. Thank you.